So here is few question and answer for NCLEX board. First question is for a client who takes the over-the-counter drugs regularly. So the nurse should ascertain or make sure what information out of 4. Number 1, whether the drugs are expensive or whether the drugs are generic or whether the client knows the drug dose and administration schedule. Number 4, whether the client knows that these drugs are available in hospital. So there are 4 options. We have to choose which one is most important, which one is most beneficial to the patient, right? So number 1, it is expensive or non-expensive. It is nothing related to the harmful to the patient. Nothing related to the threatened to the health. Number 2, drugs is generic or not trade. It is not the patient concerned. Number 3, if my patient do not know about the correct dose or route or administration schedule, if client choose a wrong dose, less than accurate amount, this medication will not work. If it is more than the normal dose, it can cause overdose or poisoning. So this is the most important, that my patient aware, my patient are concerned about the doses and administration schedule. Because some medication we should eat before it. Some medication good to take with food. Some medication good to take after food. Easy example, like proton pump inhibitor. The proton pump inhibitor we took, like omeprazole, isomeprazole, we took for gastric ulcer. It is good to take before food, but antacid good to take after food. Like iron, it is good to not to take with antacid, not to take with milk or dairy product. And also number 4, when the client knows that these drugs are available in hospital, it is also not priorities. So why number 3? And what is the rationale? The nurse should determine whether the client knows the doses and administration schedule for any over-the-counter drugs he takes regularly. The nurse also should determine whether the client knows why he takes each drug and the proper way to administer it. Neither the drug or nor its generic classification are as important as these factors unless a problem arises with either of them. Availability of drugs in hospital is not a high priority unless the client wants to buy or purchase the drugs from outpatient pharmacy. So out of 4, we have to choose which one is more related to patient body, right? Yes. Now, second question: a small air bubble adhere to the interior surface of a syringe might have which effect on parental? What is parental administration? Parental medication or administration are the drugs given to the route other than the elementary respiratory. So if you feel anything at the mouth, we call parental. So when a patient, healthcare provider is ready to give the injection, suddenly found a small air bubble. Why this is important? So alter the onset of action, alter the duration, alter drug absorption, and alter the drug dose. So they said which effect occur on parental administration out of these four. They said alter the drug dose. Why? Although not harmful to a client when injected a small air bubble. Keep it note, it is small, but big air bubble can cause embolism, right? But small air bubble can actually change the dose of medication administered. Therefore, the nurse should remove the air bubble. So this is the alter the dose. And if the air bubble in the syringe, we must remove it. Because air bubble, small air bubble later on get bigger, or small air bubble united with another air bubble and make a big bubble. And when they passing through the microcirculation, they fall in stuck, like pulmonary circulation, like cerebral circulation, and then can develop the pulmonary embolism or stroke. So as a healthcare provider, it is our priorities to remove the air bubble. So the nurse should remove the air bubble. Small air bubble would not affect the drug's onset of action, would not affect the duration, or would not affect the absorption. The air bubbles may be helpful in some situation, but should be added only after the dose of the drugs has been withdrawn accurately. For example, with the iron dextran. So iron dextran is the injectable form of iron. Imagine a patient has iron deficiency anemia. We give them injectable iron, and injectable iron is called the iron dextran. So with the iron dextran, and the Z-Tech method of injection help to prevent the parental staining of client skin if the solution leaks into the subcutaneous tissue. So basically, the state have which effect is parental measure. They altered the doses. Another question here, when caring for acute exacerbation of acute gout, the nurse anticipate admin which medication. So in the picture, you can see this is the big toe, and this toe joint is soiled, reddened, swollen up. It is inflammatory change, and patient also complain of pain. And this is actually gout. We call it acute gouty arthritis. It is a type of arthritis that causes the inflammation of the joint. Why inflammation? Because of or due to the excessive uric acid accumulate in the toe, particularly or usually in the big toe, right? So this is the happen But I said, usually the gout is a chronic, and sometimes chronic disease acute exacerbation. We call acute gout or acute exacerbation of the chronic gout. So allopurinol or colchicine for the gout. But which one you choose is depend upon, is it acute condition or chronic condition? If it is acute condition, always we prefer colchicine. If it is chronic condition, we prefer allopurinol. What is their rationale? The healthcare provider usually ordered colchicine for the client experiencing an acute gout attack. Question come in your mind. The physician usually ordered colchicine for the client. So as a RN, why I have to know this? Yes, you have to know this because your patient have to take colchicine or allopurinol for the gout. And in the question, you can see the nurse anticipate. So what you anticipate, your doctor may be prescribed. So the drugs, this colchicine, these drugs reduce the leukocyte motility. The leukocyte is mobile. They can walk. So they can kill the bacteria. And this process is called phagocytosis. And also lactic acid production. They can therefore reduce the uric crystal deposit and reduce the inflammation. And as you know, the gout is a chronic inflammation. Colchicine can reduce the inflammation. What else? What else about the allopurinol? Allopurinol is used to reduce uric acid production in the client with chronic gout. Although steroids, particularly corticosteroids, are ordered to treat the gout, the nurse would not give them because they must be administered intraarticular for the client. So what does it mean, intraarticular? So imagine a patient came to you with very bad gout condition. In emergencies, we give them injection inside the joint. It is called intraarticular injection. So next here, also we use the prophylaxis. An opioid may be used to treat osteoarthritis. Why opioid? Opioid is a pain medication. The gout patient have a common sign and symptom of what are the common signs of the complex form of arthritis, and that can affect anyone, particularly who take, beer or alcohol. And it is characterized by attack of pain. Because of pain, we give them opioid. And it is difficult to walk, if you were to say. And so we use steroid for inflammation. We use opioid for pain, but drug of choice is allopurinol or colchicine. If acute condition, colchicine. If chronic condition, drug of choice is allopurinol. What next? After a series of tests, a 6-year-old client, body weight is 50 pounds, is diagnosed with a complex partial seizure, right? partial seizure, the physician ordered phenytoin. Other name of it is called Dilantin, and the amount is 125 milligrams by mouth twice a day. After the nurse admin phenytoin, where the drugs metabolized. You see in this question, examiner try to make you confused. Number one, your patient is 6 years old. They give you the body weight in pound, but this question, nothing related to the body weight. Nothing relation to the 6 years age group. But your patient diagnosed with the seizure. What is seizure? Particularly right? So keep in mind, a seizure is a sudden or uncontrolled electrical disturbance in the brain, and it can cause the patient behavior, patient movement or feeling, and in the level of consciousness. So if a patient have a fever, having 4 hours apart that are not known by identifiable cause in general considered to be epilepsy. So that keyword epilepsy or seizure almost same. But easy way to remember, it is the sudden uncontrolled electrical disturbance in the brain. And patient has a behavioral problem, movement problem, feelings problem, also alter the level of consciousness. So if your patient has a seizure, we give them anticonvulsion medication, anti-seizure medication. It is called phenytoin. Other name is called Dilantin. But our question is nothing related to this. Examiner asks you, where the medication go for metabolized? So liver is the organ. Most of the medication go for metabolism. So metabolism is a chemical reaction where energy produced or drug is metabolized, an ingredient is released out, and waste product is go through the kidney, expel out. If the examiner asks you which is the organ the waste product expel out from the body, you should choose the kidney. But when question come about the metabolism, you should choose the liver. So what is their explanation? The phenytoin is metabolized in liver. The pancreas is not involved in pharmacokinetics activities of phenytoin. The stomach absorbs only administered phenytoin, which is excreted by kidney in the urine. Next question here. Which nursing intervention take the highest priorities when caring for a client who received the blood transfusion? So blood transfusion, very important for monitoring the patient. So which nursing intervention take the highest priority when caring a client who received the blood transfusion? Number one, monitoring the client for itching, and also inform the client that the transfusion usually takes up to 2 hours, and then documenting the blood transfusion in the client care record and also assessing or assessment the client vital sign at the conclusion of blood transfusion, right? So there are 4 options. Which one is the most important for the patient to undergo the blood transfusion? So keep it note. So when a patient needs blood transfusion, as a healthcare provider, we must be there just for check the blood transfusion reaction. So before you go in exam hall, you must know what are the blood transfusion and after all, when you inject the blood transfusion, we need to check. At first 15 minutes, we have to check for any kind of allergy, any febrile condition, any hemolytic condition, or immediately stop it. This is the first priorities. So they said monitor the client for itching, swelling, and dyspnea. But nothing talk about the allergic reaction, itching, nothing talk about the febrile condition. Also inform the client that the transfusion usually takes half to 2 hours, and also documenting. So documenting is important, but it is not the first priorities. Also, we have to check the vital sign. It is also very important, right? But what are the first priorities? When you check the blood ready to transfuse, after infusion will be checked for transfusion reaction. If any one of the reaction is there, we have to stop. We have to notify to the healthcare provider, or we give them some antihistamine to stop the allergic reaction. So they said monitoring the client for itching, swelling, and dyspnea. Usually, or easy way to remember, a blood transfusion reaction are allergic either or febrile or patient have or blood pressure go down or freezing. Or blood pressure go down, but respiratory rate go up. What is their explanation? Because administration of the blood or blood product may cause a serious adverse effect, such as allergic reaction. The nurse must monitor the client for this effect, and sign and symptom of life-threatening allergic reaction include itching, swelling, and shortness of breath, we call dyspnea. Although the nurse should inform the client how long the transfusion will take or should document its administration, these actions are less critical to the client's immediate health. So documentation we do after finish everything, right? And time to time, we could monitor the vital sign. The nurse should also assess the client vital sign at least hourly during the transfusion, not just at the condition of transfusion. So next question is here. A dopamine receptor agonist such as bromocriptine relieve the antipsychotic, induce muscle rigidity. So a dopamine receptor agonist we call bromocriptine. They work in the dopamine receptor. And this bromocriptine relieves the antipsychotic induced muscle rigidity by what mechanism of action? Blocking the dopamine receptor in the central nervous system, or blocking the acetylcholine in the central nervous system, or activating the norepinephrine in the nervous system, or also activating the dopamine receptor in central nervous system. So they said the dopamine receptor agonist like bromocriptine, how works? Is it activate the dopamine receptor? Is it activate norepinephrine or block the acetylcholine or blocking the dopamine receptor? So question, dopamine receptor agonist. Number one is not an answer because this is the agonist. Agonist never block the receptor. Antagonists do this. And number 2 and 3, nothing related to the dopamine. Number 4, it is related to the dopamine and is an agonist, means activate, means stimulate the receptor. Dopamine receptor. Activate the dopamine receptor. What is their explanation? So they said extrapyramidal effect and antipsychotic induced muscle rigidity can caused by a low level of dopamine. And this dopamine, bromocriptine, dopamine receptor agonist, bromocriptine. And dopamine receptor agonists reduce the rigidity. What rigidity? Muscle rigidity by stimulating dopamine receptor. And dopamine receptor agonist does not affect norepinephrine or acetylcholine. Nothing. Number 2 and number 3 never related to dopamine receptor agonist. Number 1 and 4 is related to this question, but number 1 is blocking. But our medication is the agonist. Agonist stimulate, agonist activate, but antagonist block. Question was about the agonist, so number 4 is the choice. Next question, during gentamicin therapy, the nurse should monitor the clients. So gentamicin is an antibiotic, broad spectrum antibiotics. When you prescribe it to the patient, what we could monitor? Serum potassium level, serum glucose level, or partial thromboplastin time, or serum creatinine level. What is our answer? If your patient take the gentamicin, we have to check the creatinine level because they have a nephrotoxic effect. So during the gentamicin therapy, the nurse should monitor the client's serum creatinine level because the most notifiable effect reaction of aminoglycoside therapy are nephrotoxicity and ototoxicity. So nephrotoxicity means they have a bad effect over the kidney. And ototoxicity means they have a bad effect in your hearing cell. So the question comes about gentamicin, but in the explanation they explain aminoglycoside because gentamicin, one of the member of aminoglycoside. And also keep it note, aminoglycoside is the broad spectrum antibiotic or bacteriological category of traditional gram-negative antibacterial medication. And aminoglycoside that inhibit the protein synthesis and contain as a portion of molecules as amino modified glycoside. So nephrotoxin and ototoxicity. And these drugs does not appear to after serum potassium or glucose or PTT. So if examiner asks the question about the warfarin or heparin, we must check the PTT, partial thermoplastin time. If question come about the steroid, glucocorticoid, right, or cortisol, we're supposed to think about the glucose level because steroid increase the blood sugar level. Or if your patient need to take insulin, we need to check blood sugar level. Patient chance to develop hypoglycemia, right? Or if your patient has to take the diuretics like fusamide, Lasix, we need to check the potassium level. So what examiner asks, let's try to figure out the keyword, then choose your answer.